The study is done in collaboration with UC Riverside, and our fundamental question is, can visual function be improved with either vitamin therapy or by exercises, or actually combining the two, can it give you a more beneficial outcome? It is very important that we be able to measure the visual function accurately, as well as is there a way to enhance the visual function in cases where you have these chronic degenerative diseases which is taking away the function of the retina. So as a first step, we decided to evaluate visual function and check its repeatability of various testing measures in a group of population that we were interested in. We were interested in looking at young, healthy individuals and if we can show improvement in visual function. So we chose a battery of tests, a group of tests, certain contrast sensitivity testing, and certain visual acuity testing. Visual acuity, the standard has always been ETDRS testing measures, where we have other measures also available, and we were trying to see if this was reproducible or repeatable in short term, as well as slightly long term, meaning a week later, what was the reproducibility of testing, to get an overall idea of the noise in the data. And we find that it's interesting that certain metrics perform better than ETDRS system, and having an idea of reproducibility of all these values will set the tone and the baseline for our next experiment. ETDRS was an excellent test for its time, but we have to look back and say that was 30 years ago. Can we improve upon some of these things that we have learned and make them better? And I believe that doing the same thing over and over again, we will be stagnant, and looking at some of these newer techniques, perhaps even contrast sensitivity, might become more reliable entity of measures in both disease and healthy individuals.